You're listening to the VA Claims Authority. I'm Gary, Air Force veteran, VA disability claims strategist, and the guy who got denied, fought back and won. I'm here to make sure the VA doesn't leave you behind. Whether you're filing your first claim or fighting your fifth appeal, this is your briefing. Let's get into it. The single sentence that turns a medical note into money. That one line written the right way is the difference between a claim that the VA awards and a claim that stalls for years. In the next 10 minutes, I'm going to give you three things. A practical 3-sentence Nexus template you can hand to your provider, a clear filing map so the VA actually sees it, and one action you can do today to lock this evidence into your claim. No fluff, no legalese, just what works. First, definitions. What are we even talking about when we say DBQ, provider statement, and Nexus letter? ADBQ is a disability benefits questionnaire, a standardized form examiners use to capture objective findings. DBQs are great when used for conditions with measurable signs like range of motion, hearing loss, or lab results. A provider statement is usually a short note from your treating clinician, often brief and missing the reasoning the VA needs. A formal Nexus letter is a focused medical opinion tying your current diagnosis to your service. It explains the link, gives a clear medical opinion, and shows the rationale. Each has a place. ADBQ fills in the objective testing. A provider statement can support the picture. The Nexus is the explanation the VA wants. Second, the anatomy of a winning Nexus. There are 4 essential components the VA looks for. Say them with me. Service link, clear opinion, medical rationale, and supporting facts. Start with the service link. A short sentence that anchors the claim to your service. Then the opinion, the magic phrase is the VA standard, at least as likely as not, which means 50% or better that the condition is related to service. Next comes the rationale. The provider must explain why they reached that opinion using medical reasoning, not just saying it could be related. Finally, supporting facts, dates, symptoms, test results, treatment history, things that make the reasoning credible. To be specific, here are the 4 lines the VA examiner wants to see, in plain order. 1. This veteran has a diagnosis of X. 2. It is at least as likely as not that X is related to the in-service event/exposure/illness. 3. Medical rationale. Here is the pathophysiology or timeline connecting service to current condition. 4. Supporting facts. Symptom onset dates, objective tests, treatment notes, and any continuity of care. When those pieces are present, examiners stop guessing and start assigning service connection. What at least as likely as not actually means and why it matters. The VA uses a 50% threshold. If your provider says it's more likely than not, or uses weaker hedges like possibly or may be related, the opinion can get ignored. So ask for the VA phrasing exactly, at least as likely as not. If a provider refuses to use that wording, they can still provide a strong rationale, but the exact phrase removes ambiguity for the adjudicator. Third, how to get one written. Who should write it? A private specialist who treats your condition is usually the best option. They can speak to the specifics and cite tests. VA clinicians can write acceptable Nexus opinions too, but sometimes they decline to use the at least as likely as not language unless the evidence is strong. Bring your provider 3 things. Service records showing dates and events, a concise symptom timeline that shows continuity, and the objective tests or imaging that support the diagnosis. Give them the template. Don't expect them to invent the wording. Red flags that make an opinion weak. Hedging language like could be or possible but unlikely, no medical rationale, just a statement, or opinions based only on the veteran's report without objective support. If your provider gives you a weak letter, ask for clarification and for them to add medical reasoning. For example, cite how a mechanism of injury in service can cause the condition now, or how imaging and tests support the progression. Now, the practical templates. Give your provider this 3-sentence Nexus and ask them to sign it. You can copy/paste this exactly. 1. The patient, veteran's name, has a current diagnosis. 2. It is at least as likely as not that diagnosis is related to the in-service event/incident/exposure of brief service event or dates. 3. Rationale. Brief medical explanation connecting the in-service event to the diagnosis, citing tests or symptoms, and relevant pathophysiology. Keep the rationale specific. Point to a test result, imaging, or a documented symptom, onset date. If your provider will expand, great, but this 3-sentence form meets the VA's needs. Here's an email you can copy/paste to your doctor. Hello, DriveX. I'm filing a VA disability claim for condition. Could you please provide a signed medical opinion on my behalf using the 3-sentence template below? I have attached my service record excerpt and recent test results. The VA accepts the phrasing, at least as likely as not, for Nexus opinions. If possible, please return the signed letter within 2 weeks. Thank you. Short, polite, and gives them everything they need. Action step. The one thing to do right now. Download VA Form 21-4138. That's the statement in support of claim. Attach a 1-page service record excerpt showing the in-service event or dates and a 1-page symptom timeline. Email your provider the 3-sentence template and the attachments and ask them to sign and return the letter within 2 weeks. File the return Nexus with your claim by uploading it to your VA benefits account or by mailing it and noting it on VA Form 21-4138 so adjudicators see it in the claim file. Quick checklist to avoid common rejections. 1. Use the phrase at least as likely as not. 2. Make sure the provider gives medical rationale, not just an assertion. 3. Include dates, tests, and a timeline. 4. Submit the signed letter with VA Form 21-4138 or attach it directly to the claim so it becomes part of the record. 5. Combine the Nexus with objective tests and at least one buddy statement if possible. Don't rely on a single document. If your provider refuses to use the exact VA wording, get whatever they will write, but then consider a second opinion from a specialist who will provide the needed rationale. And remember, the VA can't read your mind. Clear, reasoned medical language makes their job easy and makes your claim stronger. That's your briefing. Now go execute. If this episode helped you, share it with a veteran who needs to hear it. And if you need help with your claim, whether it's an audit, a rebuttal, or a full strategy session, head to vaclaimsauthority.com. I've got the tools and the experience to help you win. I'll see you next episode. And remember, your service earned this. Don't let paperwork take it from you. The VA won't tell you this. I will.